Hi, I'm Sherry Russell. I'm a certified nurse practitioner. Welcome to Body Talk.
Hi, I'm Mike Thompson, interested guy.
And today
I just ask a lot of questions.
That's good. We need somebody to do
Right.
that. And today we are going to be speaking with John Perry, who is a physical therapist and a certified personal trainer. February is Heart Awareness Month, and we thought we would discuss that a little bit and the importance of physical activity to your overall general health throughout the lifespan.
Right. This is true. I've had two bouts. I've got 3 stents. So I've had heart problems. And the reason I have that, partially, I've got a sedentary job. And I've got low, good cholesterol. So if you go get a cholesterol test that is looking only at bad cholesterol, I'm great. It's the bad cholesterol, it's supposed to be like 40 and mine's like 20. And so that's where I have that problem. And there's not a lot you can do to get that number up.
Well, you want to look at the entire, you want to encompass all of it. You want to look at an entire lipid panel to focus on all that with the heart health as well.
And sugars and those things that get your triglycerides up, that's not good either.
No, that's
And I was going to say that what do you think of when you think, oh, that's a heart attack victim there just waiting to happen? And it's not always a 350-pound dude that's sweating with a red face.
No, over the last 30 years, I have seen people that are incredibly physically fit have an MI, a heart attack. I have seen people that are very young that you would never think. Women in particular tend to have what we would call more of a silent heart type heart problems. Women tend to ignore their symptoms as well. It's not always the classic, there's an elephant sitting on my chest, I've got jaw pain. A lot of times it can be a lot more subtle, and different people are different. Diabetics, for example, will present in a different way than someone that does not have diabetes may present. There's a variety. You cannot.
And don't take a chance. Me and my wife were eating at a restaurant, and she was having the cheese fries and something to drink and all that, and she was starting to feel the chest pain, the arm pain.
Hi, I'm Sherry Russell. I'm a certified nurse practitioner. Welcome to Body Talk.
Hi, I'm Mike Thompson, interested guy.
And today
I just ask a lot of questions.
That's good. We need somebody to do
Right.
that. And today we are going to be speaking with John Perry, who is a physical therapist and a certified personal trainer. February is Heart Awareness Month, and we thought we would discuss that a little bit and the importance of physical activity to your overall general health throughout the lifespan.
Right. This is true. I've had two bouts. I've got 3 stents. So I've had heart problems. And the reason I have that, partially, I've got a sedentary job. And I've got low, good cholesterol. So if you go get a cholesterol test that is looking only at bad cholesterol, I'm great. It's the bad cholesterol, it's supposed to be like 40 and mine's like 20. And so that's where I have that problem. And there's not a lot you can do to get that number up.
Well, you want to look at the entire, you want to encompass all of it. You want to look at an entire lipid panel to focus on all that with the heart health as well.
And sugars and those things that get your triglycerides up, that's not good either.
No, that's
And I was going to say that what do you think of when you think, oh, that's a heart attack victim there just waiting to happen? And it's not always a 350-pound dude that's sweating with a red face.
No, over the last 30 years, I have seen people that are incredibly physically fit have an MI, a heart attack. I have seen people that are very young that you would never think. Women in particular tend to have what we would call more of a silent heart type heart problems. Women tend to ignore their symptoms as well. It's not always the classic, there's an elephant sitting on my chest, I've got jaw pain. A lot of times it can be a lot more subtle, and different people are different. Diabetics, for example, will present in a different way than someone that does not have diabetes may present. There's a variety. You cannot.
And don't take a chance. Me and my wife were eating at a restaurant, and she was having the cheese fries and something to drink and all that, and she was starting to feel the chest pain, the arm pain, nauseous, sweating, you know, uneasy feeling. Went to the ER. It was her gallbladder. So it's not always a heart attack, but you got to go look and make sure.
And until you can rule out that it is, you have to treat it as such.
Right. So we left promptly.
Absolutely. Absolutely. And well, today we have John Perry with us, who has a wonderful, wonderful background, and he, I think, will be very.
Well, thanks for having me. I'm excited about being here, and I have a history of, I know Mike for a while, and of course you for a while, coming to you for care in Jackson, and which is like a block from my house, which is awesome.
It's so fun to see you guys.
Yeah, but I'm a physical therapist in Jackson, work for Tri-State Rehab. I'm the director there, and we work in conjunction with a fitness center right next door. It's managed by Jamie Ball and his wife, Jenny. And my focus, whether it's with heart conditioning, fitness, is talking to people about what are you doing day to day to work on overall fitness, which ultimately will help your heart. So whether they're coming from a surgery, they've had injury at work, like workers' compensation, or come from the fitness center because they're doing something wrong over there. So, and like we were talking with Mike before we started, just getting out daily, whether it's walking your dog. Sometimes we talk about 10,000 steps. Which everybody has the watches now or the Fitbits to check that out. But some of the things to look at, if I had to give some keys for people for fitness or heart conditioning or fitness in general, is working the body how it's supposed to move. Because we get hung up on these machines or the last infomercial, you know, on TV, you stay up at night and you watch it, and you can get yourself in some trouble doing that.
And there's always something new coming out.
So whether it's joint, they keep me in business actually. Okay, so whether it's a joint pain or they're not actually working the body, how it's designed to work. The body works in 3 planes, we call it. So forward and back this way, side to side, and twisting. And so as long as we're trying to move in multiple planes with our exercises in more dynamic fashion, it's going to help your heart, it's going to help conditioning, it's going to help joint pain, you know, in general. So
another thing I've learned too is, you know, every once in a while you got some back problems, and you need to have that core strength to help support your bones. You can't, you know, it's whenever you get in bad shape, you rely more on your skeleton to support you, and then that's when it gives out. So you need strong muscular core to help support your
Absolutely.
And I know whenever we see a lot of people in the office, you know, back pain is a very, very common issue that all of us at one point or another will have. And you know, you talk to people about the importance of core strength. Walking being one of the best things for back pain. And sometimes people look at you like you're crazy. And
it couldn't be that simple.
It's not that easy. Don't just walk.
Yes, it is.
You know, and of course you know would want to treat appropriately with the medicines, whether it be you know NSAIDs, you know whatever in relation to wherever the pain is. But a lot of times, you know, we'll refer to physical therapy for back pain, and to build that core and give them that.
Exactly. And one of the things we start with is, well, what are you doing now? Okay, well, I've been doing this for years. Well, how's that working out for you? You know, so not well if you're still sitting here. So can we move it differently? So you see people doing crunches all the time, but that's not how we walk around bending like this. So we work on even the John Travolta move, which you guys will know what I mean. Somebody may not that's watching.
All right.
Okay, John Travolta in the 3 plane, just in a chair, moving in 3 planes will work the core like it's supposed to. And so you take that and extrapolate it into your walking and daily movement, and just getting off the couch and doing that, especially after you eat, to moving in the 3 planes, exercising the body and saying, rather than just sit here and then do isolated movement and do things that don't make sense to the body, why don't we look at it and approach it differently, give a different mindset.
Sounds kind of like a common sense kind of approach to it.
That's the point, I hope.
Absolutely.
Yeah, I hope, yeah.
I've heard a lot of people, you know, whether they're overweight or whatever, that say, I can't work out because when I do, I'm breathing hard and I'm sweating and it must be a bad reaction. I'm like, no.
You're not allergic to exercise.
No. You're supposed to be doing that.
Right, and you can break it up. I wrote a book a few years ago, and that's where I got involved with Mike. But they're 10-minute exercises, so you can do a 10-minute routine, I should say, once or twice a day, like an AM and PM, and break that up, and then do a walk with your dog, or walk down the block, go get the mail, whatever it is in between, and still get, you know, flexibility benefit, cardiac benefit from short bursts of exercise. And then it comes back to diet, which you probably talk to your clients about a lot. So people are eating bread and sugar and a lot of wheat, which they think is benefiting, can be detrimental to their breathing and how they handle exercise.
Absolutely, and you cannot exercise away a bad diet.
Right.
It's what is it? I've always been told, was it 80% diet, 20%
Yeah.
exercise? Is that that the thing?
Yeah, I mean, we talk to professional athletes. They say the first thing I do if I want to gain muscle or get in shape is look at what I'm eating. I start there before I ever pick up a weight or exercise. So absolutely.
It is, and I think, when you were touching on your book about with the office things and
Yes.
stuff, you know, because you hear every day, everybody, and I'm very, very guilty of it myself. I'm just too busy to do anything. I used to work out, but I'm too busy. I'm gonna make time for it again this year. That was my New Year's resolution back 2 months ago. So see, now you've motivated me. I can do it now. But it is. We are all very guilty of that, and I hear it all the time. And people are, you know, we're busy. But what I have found over the years is that people make time for what is important to them. And,
Exactly.
and honestly, if we do not have our physical health, we have nothing.
Yes.
We do not.
Yes.
Jobs don't matter, and nothing matters if you're not in
Beautiful.
good physical health too.
Yes. It comes back to what you value. You know, and if
Absolutely.
you value that, you're going to take the time to do it. So
Absolutely.
all patients, anybody I deal with have a why. This is why I want to do this. This is why I want to feel better. So once you figure that out, that's going to get you up in the morning to motivate you to do what you need to do. So, well, I'm overweight, I don't want to be. Well, you must want to be, or you be doing X, Y, and Z.
It is, and you know, and you look at a lot of factors. You look at, you know, genetics. You look at this. You know,
Sure.
You look at, but it essentially it comes down to. And I always tell patients also, you know, you can't control your genetics, but you can control your risk factors. Sure. You can control what you put in your body. You can control how much you're smoking. You can control how much exercise you're getting. And people are, and I think that's a good point also when you were talking about the different levels for everybody, whether it be just walking. People think they have to, go out and get started out with a physical trainer, and you're going to do an hour of running a day and lift weights for 2 hours and do all this.
Right.
But it's not. It's finding what works for you.
It's a lifestyle.
It is
Yes.
a lifestyle, and that's the key. I think is finding, because if it's something that's unattainable, you're not going to keep doing it.
No.
It's
Yeah, well, nobody wants to do anything they're not successful at doing.
Absolutely.
And so if you can find success first, so like in the clinic especially, we start with your successes first. So if this hurts, don't do it. It's not no pain, no gain. So let's start, whether that's cardio work, whether it's flexibility, I'm trying to decrease your pain. We want to start with success and build on success. So they're more likely to do it and follow up just because this makes sense to me. Yeah.
absolutely, and they're going to feel better.
Sure.
Yeah. What has been your experience, John, when you have someone that comes in and say they've had an injury and they've not had any exercise, they've not taken care of themselves, versus someone that is, moderately in decent shape, and you're working with that person to rehab them for whatever their injury is, whether it be cardiac, knee, whatever.
So start with, I think everybody needs to, and like you do this really well when I come into your facility, is educate the patient on why.
Absolutely.
So if somebody doesn't know why they're doing what they're doing, I have less of a chance of doing it. Go do 20 of these. Well, why am I doing it? So I want to educate them and say, if you do this, here's how it will benefit you in the long run. So somebody that's less fit, less successful doing exercise, we may start in setting. Okay, you can do these 3 exercises 3 times a day. Here's how it will benefit you. Let's start here. Or somebody else, okay, we're going to pick up dumbbells because you're not going to do it unless I push you a little bit. But I have to at least, and you do this when you do your subjective portion or when you talk to your patients, I need to find out about this person, what makes them tick, what's going to motivate them, what's
Of
their
interest
why,
to them, yes.
and then that's how I can build the program. And all of a sudden they're thinking, well, he's listening to me, she's listening to me, it makes sense what I'm doing, this will be the result if I do it, so they're more likely to carry it out.
And I think that's a great thing too. I think like you say, you personalize it. We're not all going to be doing the same thing, and
Exactly.
it's not going to be effective for
Exactly.
everybody. So that's why
Yeah.
we like to send people to you and let you get them back on the right track.
Well, as I get older, I see that I don't have to do as much. I say, I got to do this and every day, and sometimes less is more, less is better. So if you explain, we'll do these things, here will be the benefit. Here will be the benefit to your nervous system, your balance, proprioception, everything that needs to go along with cardiac rehab or flexibility, just fitness in general. So
Or even just getting your guts moving. Just like my dogs,
For
I
digestion,
take them for a walk and
Eat
stuff
dinner,
happens.
Go walk. Yeah.
Well, you got to be careful with eat dinner and go for a walk. My dogs have had the stomach twisting thing, so we got to wait like an hour before we do that. They are a great incentive to go walking because they're in your face and go, hey, let's do something, let's do something.
sure.
And tired dogs are happy dogs, and a tired me is a healthy me. So what if you're looking for goals, you said 10,000 steps. How far is that?
5 miles.
5 miles. Okay. So I usually go about 1.5 miles, maybe 2. That's as far as I get, and I don't have real energetic. I don't have huskies, so I don't go that far. But the other thing you got to look at too is like what you were saying, what you put in. And being older, I realized, when I hit 30, I started slowing down. The metabolism. So I needed to eat less at 30. And what I've realized again, I think when you get 40, 50, you got to slow down a little bit more on the eating. Not slow down on your activity, but your eating, you got to cut back. You can't eat like you were 20 when you were 30, and you definitely can't eat like you're 20 when you're 50.
Yeah.
It does. And
Agreed.
I think as we get older, too, and I think we've all been that, when you're 20 years old, if you want to drop 10 pounds, you drop 10 pounds and, and it's no big deal. And now when you're almost 50, it doesn't happen that well.
Exactly. Same with injuries, that you recover much quicker.
Yes, absolutely.
When you're younger
and I
than
think
you do when you're older.
I think that is truly the key with, with these things is if you can keep that, you don't have to be a, marathon runner or participate in, weightlifting shows or whatever. But if you maintain that certain level of fitness, your body is going to be much more likely to recover and do better with those things.
So if I can't walk 5 miles, are there upper body things that I can do that?
Yes, what I would do is almost create a circuit for somebody in their home. So when you're in your recliner, do your John Travolta reaches where you do with the remote, okay?
Right.
Then I want you to walk to the kitchen and do this at the sink. But you can rest in between, but it's almost like each room has an activity. A sit to stand off the edge of your bed when you get up in the morning, okay? When you're brushing your teeth, you do a little hip movement, almost like you're dancing, like a Zumba move. And so rooms equal activities, and in between I'm walking, so I can get my cardio and exercise, even in the home, like after a surgery, a total knee or something like that.
No, I've also heard that you're supposed to keep your heart rate above a certain point for a certain amount of time. What you're saying, that doesn't quite match that.
I don't focus on that enough because you will get people that say, at least in my experience, no thanks. Okay, so what we do is use numbers. And this is what I did in the book. So a level 5, for example, you're level 5. So 0, I'm asleep on the couch. 10, I'm being chased by your dog.
Right.
Okay, so I'm scared. So at a level 5, I'm walking what's comfortable to me, but I'm not slowly, methodically walking. After a minute, take it to a 6. What's your 6? After that, to a 7. So for me, it may be jogging at 7, but for someone else, it just made me a faster walk. So they, in their head, they know I'm just changing my pace, and then I take it back to a 5. So every 4 to 5 minutes, you're doing like an interval training is what you're doing. So I'm not thinking about my heart rate, but it actually is changing. So I'm doing the same thing, but it's like a mindset.
And I hate running, and what I do instead of running is walk up hills.
Good.
Go in the woods
Really good.
and
Pump
go
your
up
arms,
hills.
yeah.
Absolutely. Have you found, we were talking about, everybody has the Apple Watch, the Fitbit,
Yes.
Everyone has the...
Or the phone.
Yeah,
Or
the
phone now.
Yeah,
Yeah.
absolutely. Do you find that people, when they come to you now, they're a lot more focused on
Yes.
what do I need to do so this is...
They're more aware of ways to do that. Doesn't mean that they are doing it the right way, which helps me to explain it to them. But they are more aware with technology, yes, and what they see on TV or what their friends are doing. That's another point of it is, my mentor taught me this, but it's you versus you.
Absolutely.
So I'd rather look at you and your weight loss and your conditioning, not comparing to me or your husband or your neighbor or whoever else. If you focus on you versus you, they tend to say, okay, this is what I'm trying to do and trying to improve, not compare to you.
Well, you probably get a lot of people if they come to a gym, and I think a lot of times if people come to to a gym, they look around and they see, oh my gosh, everybody's in so much better shape than I am. I just can't do this. I think that's probably an important thing to point out. You're not competing with anyone but yourself.
Yes,
you're just here to make yourself
Where's your
better.
baseline? And I just want to move along this baseline
Absolutely.
to get better the other direction. Sure.
Yeah, because I think that's very intimidating for a lot of people. I think people have that mindset of it's either all or nothing instead of finding a happy medium of what works.
Or when I get in shape, I'll go to the gym.
Yeah.
You
when
kind of start
I lose
somewhere
50
first.
pounds, I'm going to go to the gym.
Exactly.
But and we've all been there. It's my weight's been all over the place my entire life, and so is my fitness activity. And my weight has correlated with what my fitness activity is actually. Shocking, but it is. And I find in the office too, you'll have people come in and they will, and they're have very little fitness. Physical fitness at all, or they, a very sedentary lifestyle, drink a lot of pop, which is I always try to steer everybody away from that because it just makes you feel bad and it makes you crave, even if
At
it's
least
diet
they
pop.
cut it back.
Yeah, absolutely. I always talk to them, at least try switch to diet, and then diet's not good either because it does it has all the chemicals in it. Makes people crave
sometimes it's
more
worse,
carbs
and the
sugars.
gluten-free doesn't mean it's gluten-free
absolutely.
necessarily. So.
Absolutely.
I see things on Facebook that says if you drink a couple glasses of wine, that's like so much time in the gym.
I saw that the other day.
What do you think about that? Because I know red wine's supposed to be good for
I think I'm going to test that theory.
your heart.
Me too.
We'll conduct a research.
Yeah, I'll let
John.
you know. So next time you guys have me back, we'll go over that.
Okay.
I'm in the gym all the time.
Yes. Good dark chocolate go with that as well. Maybe
Yeah.
some cheese,
There you go.
strawberries.
Perfect.
We'll come up with something.
That's
good.
antioxidants.
And we'll write a book on it.
Yeah.
Okay, perfect.
Perfect. But it does. But I always encourage people, and even actually with, of course, when you look at diabetes, heart disease, everything, back problems, muscular problems, joint problems, exercise is always, we always try to incorporate that. I always tell patients, you can't just look at, it's not one thing is the magic answer. There's not one, people come in and say, give me a medicine to make me feel better. There's not one medicine that's a magic answer. I always tell everyone, whether it be when I'm seeing someone in my office, like in a family practice setting, or at Woodlands on a mental health setting. It's pieces of the puzzle.
Beautiful.
The medicine is
Yes.
one piece of that puzzle. Exercise is another piece of that
Yes.
puzzle. Whether it be, for depression and things, ways, encourage counseling, things like that. But, you have to put all the puzzle pieces together, diet and nutrition. And there actually are studies done, and I can't remember where or when, but I had read years ago a study that talked about depression was, with depression, exercise was almost as beneficial at times in certain people as medication.
Just with endorphin releases.
Yes.
And even if, a lot of times you read in books, do it for 30 days.
Yes.
Well, that's a lot of time for a lot of people doing it every day for 30 days. So even if you do it, let's start with a week. Okay, did you get it in every day for a week? And once you start having that habit, then you wake up and, okay, I have to do this or I'm upset. I don't feel the same way. I don't have the same motivation unless I'm actually doing that every day. So it just becomes a lifestyle, like Mike was saying.
And for example, like with antidepressants, those need to be in your system about a good 30 days before you're going to see if they're effective or not. And by all means, there are people that do need the medicine for on that. But it's, if you look at 30 days to see if a pill's going to work, Give it 30 days of exercise too.
Sure.
But in creating that habit and whatever you're doing.
Yes. We'll talk to people who want to lose weight anyway. Go ahead and have your dessert, but this is the day you have it. That's it. And so they know it's coming. Versus you can't have it at all for 30 days because what's going to happen? I just have a little bit today. Yeah. But I know it's coming on Sunday, so I'm ready. I'll go to the grocery and pile up whatever I got to do. But that's my day. That's my cheat day or whatever. So at least they're still doing it without going cold turkey, but it becomes more of a habit that way if they.
How do you feel about? And I'm sure it's probably pretty individualized, but how do you feel about the group type activity when people have like if they have like the group activities? I know exactly for at Preferred Fitness. I know Jamie does.
Jamie does it, and he does these boot camps.
He does the boot camps, and I know those are very
and it's
successful.
amazing because there's different levels of boot camps. Because you hear boot camp and you go, not for me. But he can just start with even marching in place, and it's motivating because I'm at the same level you are. You're trying, so I know I have to get up in the morning and come do that because you'll be there. And if not, Sherry's going to be calling.
Right, you're accountable to someone
It's accountability,
else.
so I think it works really well, and we see a lot of success with it there. And I'll actually take patients when they quote-unquote graduate, they're done with therapy, and we'll put them into boot camp at what level they need to go, and they've already started it with me, so it works really well.
Yeah, I think that's great. And actually, I had worked out with Jamie for a while, but it was a scheduling conflict because I kind of have. I know. I need to find a home workout thing, so I need to for right now, and then we'll get back into boot camp.
There you go.
But it was I really liked that setting. I did. It's very motivational having somebody there, and when you're not, and making sure that when you do get into the more advanced, into the weightlifting and things like that you're using the correct form. You're not doing anything that's going to cause injury to yourself.
Right. Because just because it's on the internet doesn't make it true.
No, absolutely
amazing,
not.
isn't it?
I know.
Yeah.
I know.
It's not that way in all things.
Yeah.
So.
But
the people think that way. Hey, I saw it on the internet. I saw this guy do a video. He must know what he's talking about. Let's do it. And they'll come in and I'll say, well, what'd you do? Well, I did this video, insanity workout or whatever it might be. Well, okay.
Do you find that you're doing a lot of corrections with people with form and things like that, where they've picked it up on a video or something? And
or just I've never done this. I don't know what you're talking about. So we start, like I said, either in sitting or modified. So instead of doing a lunge, they start in stride stance and move their hips or move their arms. And so we build on success.
Okay.
Yeah.
And I think, and that's why I like sending people your way from my office, is because they, I know it's going to be individualized, and I know that's what physical therapists and personal trainers do.
Right.
But it's going to be individualized. You're going to get them where they need to be, and it's not going to be just a cookie cutter
Protocol cookbook. Yeah.
Absolutely.
And a personal trainer doesn't act like on that one weight loss show. They're not in your face and screaming at you, right?
Unless you pay extra for that. Then they will scream, and I'll come over and add to it as well. There's bull horns, air horns. Yeah, now, that's extra, but it's up to you. I'm kidding. We don't do that. Yeah.
I don't know.
No, don't do that.
None of that. Okay.
Yeah, and I see that, and I kind of wonder. About and some of the studies will show that you see the TV weight loss, the reality, they'll actually gain the weight back just because of the methods they're using to get off quickly for the show.
They're not learning the things they need to carry it on out in real life to deal with that when they get home.
Yeah, so
hey,
I lost 10 pounds in 2 days, good for you.
Yeah.
Guess what's going to happen?
You're going to get it all back.
Yeah.
One of the first places you start, like dropping pop.
Yeah.
And processed foods, and that has a lot of sodium and preservatives and stuff. Try to get back to just frozen things that haven't been messed with, fresher. Going out to eat is my problem.
And I think it's great. All these communities locally you see anymore have we're getting a lot of farmers markets everywhere, and I think that is great. We're supporting our local economy, supporting our small farmers. We're getting fresh food. I think those are great, and I'll be so glad when the weather changes and all that can go on again. But and a lot of times people come in and they'll say, "Oh, I'm eating all these these frozen diet meals." Well, those are full of sodium and things that aren't necessarily good for us.
And it's been a winter, so I haven't been out as much. So don't dive in and go 100%, because there's been times I've picked up the weights, and then the next day I couldn't touch the top of my head.
Yeah. I mean, ultimately, I want to work out for a half hour. We'll start with 10 minutes. We'll start with 15, and as you feel more comfortable, build on that.
Okay.
Yeah.
Tell me a little bit more about your book, because actually I've known you for a long time, and I did not know you had a book.
It's called Hip to Be
until
Fit. You can still get it online, like at
Hip to Be
Amazon
Fit.
and Barnes & Noble. And it's motivational mindset on how to find your why and do those kind of things. There is some nutrition, basic, like stay away from bread, stay away from sugar, nothing in detail, and then the fitness routines.
Okay, great. Hip to Be Fit.
Hip to Be Fit.
I will be ordering that today.
Perfect.
Do I get a discount? 'Cause
I will
know
get you a copy, and I'll sign it.
Great.
Yeah. Just for you.
We get a bonus. That's great.
Yeah.
Okay. Well, but no, it's but I think this is something that it is Cardiac Awareness Month, but like I said, it's not just
It ain't just this month.
It's not just this month. It's all the time.
Right. It's a lifestyle.
But it is, and you said it that's perfect. It is a lifestyle, and that's just finding what works for you and what you can do and what you can incorporate into your life, and something that is a workable thing for you. Whether you come to someone like John and get started and learn what you're supposed to be doing, and then carry that on out, because people aren't meant to come be with you forever.
Right.
But I know. They might
As much
want
as I
to.
like them, there's a point they graduate.
Absolutely,
Yeah.
absolutely. So I think sometimes it's well worth that to get that going.
Fantastic.
Okay. Well, thank you.
Thanks
John,
for having me. It was
coming
great.
with us
Appreciate
today.
it. Thanks, Mike.
You've been very
This has been
educational.
fun.
It's
I love
fun.
it. Thank you very much.
Okay. Thank you.
So this will be a monthly show, so look for us next month on Body Talk.
Yes.
Thanks for watching.
Thank you.